Hey everyone, it's Fahim from Medlearn. In this video, we are going to be focusing on the requirements for you to become a prescriber. If you're watching this video, subscribe, like and share, because together we are going to build a better world, and I need you just to focus because you're going to have a great time and a great opportunity to really get the best out of your prescribing course. Okay, so what are the requirements for you to become a prescriber, to gain your prescribing qualifications, or even upskill yourself? This video will cover it all. It's not just about gaining a prescribing qualification, but it's really important that you become competent in what you do. So, number one, let's talk about the history or the historical background to prescribing. What you need to understand, and let me put this paper on the side. In the 90s, we had this scenario. We had a doctor, we had a nurse, and then we had a patient. The nurse was seeing the patient. The nurse was gathering information from the patient. The nurse was actually doing the diagnosis. For example, this person has a water infection. She would then call the doctor and say, I've been to Mrs. Ahmed or Mrs. Smith. She has these symptoms, sounds like a water infection. Could you please raise a prescription? The prescription was raised, the patient would get the medication. But that whole process raised questions. The questions it raised was, who's liable? Is it the doctor? Is it the nurse? Or is it shared responsibility? That's why they started to realize that this is actually going on quite commonly, where nurses are actually actively diagnosing, doctors are prescribing. Why don't we find data and start to look at if it would be possible for the nurse to just prescribe herself? The key thing I want you to highlight or understand is nurses already had the clinical skills. Please remember, nurses already had the clinical skills. They were already examining, they were already seeing patients. They had that skill set. So before prescribing existed, they already had the communication skills, they already had the clinical skills, they had the professional network, and then they were basically doing this kind of system to get a prescription. So when the prescribing course eventually did become allowed for nurses, one of the requirements was that you must already have patient-facing experience. And it's not good enough for you to just have the experience over the counter, like in a pharmacy. There has to be more. You have to be able to take a history. You have to be able to diagnose. You have to be involved in the entire process. So for example, in a community pharmacy, you might have a patient who presents with a sore throat. And if you're doing pharmacy first, that's a good chance, because you can say, actually, I am taking a history. I am examining the sore throat. I'm actually also giving medication as well from start to finish. So that means that you've got patient-facing skills. So that's important for you to remember. So initially they introduced supplementary prescribing. That is where you have a list of drugs or medicines that you can prescribe. That was supplementary prescribing. And then the nurse would prescribe from that list. Then they said, actually, let's enhance the list. Let's allow them to prescribe more. So then they introduced independent prescribing, where nurses could prescribe a lot more. Then they gathered evidence, data, and they realized it's very safe. Not only is it equally as effective within their defined scope as having a GP, they're accessible, it frees up capacity, patients are satisfied, the nurses are satisfied with their job, there were benefits all round. Then around 2006 onwards, they introduced the same for pharmacists, where pharmacists could prescribe. And then as we've gone forward, we now have other allied healthcare professionals who can do it as well. So it's important for you to remember, in terms of requirements, number one, you must have patient-facing experience. And that is not just good enough over the counter. A patient presents, can I confirm your name and address? No. Something that you're actively involved in. For example, let's say my colleague here, Sandeep, who's working, let's say this was the patient. You know, you have to demonstrate that you're taking a history, you're examining, could be in any condition. I've got some students who come to us at Medlearn and they talk about, oh, I want to do my prescribing in diabetes. Then my colleague explained to them, explain what process or what experience you have in diabetes. Are you just taking their sugar levels into the pharmacy? Or are you actively involved in the entire process? Are you taking the histories? Are you examining? Are you drawing bloods, or do you have access to the blood results? Are you then writing a prescription, advising on a prescription? Are you then monitoring the dose? You see, it's a lot more than just over the counter. So one of the requirements is that you must have patient-facing experience in your scope, and you must be doing the entire process in your scope. It's not just good enough that, oh, I feel like doing asthma. Okay, you can do asthma, but have you ever done spirometry? Have you ever titrated the doses for the inhalers? What role do you play? Or is it just a case of, actually I do a peak flow and the rest the GP does? So that's the first thing. Do you have patient-facing experience? Okay, now, and let's double check what else we have. So the first thing is patient-facing experience. So we've ticked it off the box. Then what you also need is you would need to then write a scope of practice. That is around 500-600 words where you say why you want to do your prescribing, what you will do with your prescribing course, how you're going to benefit patients, why you want to be selected at the university, and what is your area that you want to gain your prescribing in. Is it diagnosis and management of hypertension? What sort of patients are you going to see? What sort of medicines are you going to prescribe? You have to develop this entire framework. It can't just be, I want to learn to diagnose minor illnesses. Minor illnesses are huge. It has to be a lot more than that, more depth. So I want to learn to diagnose, manage and treat acute illnesses in children between this age for these conditions, and these are the medicines that I'll be prescribing. So you have a formulary as well. So that's important there. After that, of course, you must have the clinical skills in that area. So you've got to be able to diagnose, manage and treat. In addition to that, you then need to look at some legal requirements. Do you have a DBS check in place? So make sure you have that in place. So you've got your scope of practice, you've got your DBS, you've got a CV, you've got your patient-facing experience, which you can demonstrate. Right, then what do we do after that? After that, what do? Is we then look to find you a DPP, someone who can supervise you. You need to have a clinician who's been active for 3 years, who has experience in teaching, who is able to train you, because they have to offer you 90 hours of supervision. And we've discussed it in depth, how to find a designated prescribing practitioner, get in touch with us at Medlearn, or you can go on social media, use your professional networks and so on. So that's important. Once you've done that, and we've discussed that in depth, you then need to fill out the application form. And the application form can be quite lengthy, plenty of questions. There'll be questions around your personal details, your DBS, who your DPP is. There'll be questions around why you want to do the prescribing course, why you think you should be allowed on the course, how you're going to benefit patients. There'll be questions around the skills of a prescriber. So they really want to check that you're ready for the course itself. Once you've done that, you need to make sure that some sort of insurance is in place. You have teaching insurance in place, have a selected university. Once you've got all of this, then you are ready to undertake the course itself. So the requirements are simple. Number one, you must have the experience. So patient-facing experience. You must have a defined scope. You must have a DBS check. You must have access to a DPP. You select a university, you do your interview, you start your course, and you're ready to go. But remember, this course is not designed to teach you clinical skills. It's something you must already have. I hope you found this video useful. Thank you for watching. Subscribe, like, and share. Have a wonderful day. Before we go anywhere, subscribe, like, and channel. Subscribe, like, and channel. Let's do it again. Let's just start again. 1,